Dr. Alicia Fernandes, a physiotherapist with passion of helping patients reclaim their motion and live pain-free lives. Today I want to share an interesting case study with you which highlights the importance of proper assessment and diagnosis in physiotherapy. I recently saw a 31-year-old female patient who presented with severe knee pain. She had undergone MRI of her right knee, which showed some cartilage loss and mild subchondral edema. Traditional physiotherapy and medications have been tried for 3 months, but she saw no improvement. She was also advised for bed rest and avoid any weight-bearing activities. Upon assessment, I noticed that the patient had a desk job and enjoyed doing Zumba for leisure. She had been taking anti-inflammatories, NSAIDs and steroids, but the pain persisted. Based on her presentation and my clinical experience, I suspected that her knee pain might be due to lumbar radiculopathy. During the subjective assessment, the patient reported a history of chronic knee pain for the past 6 months. She described the pain as sharp and stabbing, localized to the medial aspect of her right knee. The pain was aggravated by weight-bearing activities such as walking and stair climbing and relieved by rest. The patient also reported a history of intermittent low back pain, which she attributed to her desk job and prolonged sitting. During the objective assessment, I performed a detailed examination of patient's lumbar spine and lower extremities. I assessed her lumbar range of motion, muscle strength, and neurological status. The patient's lumbar range of motion was limited in all directions, with pain and stiffness noted during lumbar flexion and extension. Manual muscle testing revealed weakness in patient's lumbar extensor muscles, particularly the erector spinae and the multifidus. Her neurological examination was otherwise unremarkable. I started her on directional preference exercise program, which is based on McKenzie method. This method focuses on identifying movements that either increase or decrease the patient's pain. In this case, the patient's pain decreased with lumbar extension exercises, indicating a directional preference. Over the course of 5 sessions, we worked on strengthening her lumbar extensor muscles and improving her lumbar range of motion. I also provided her with a home exercise program to continue her rehabilitation. I prescribed a specific exercise program to address the patient's lumbar radiculopathy and knee pain. This program included exercises to improve lumbar and hip mobility, strengthen the lumbar extensor muscles, and improve core stability. The exercises were performed in a controlled manner with a focus on proper form and technique. I provided the patient with education on proper posture, body mechanics, and ergonomics to help prevent future episodes of low back pain and knee pain. I also instructed the patient on how to perform self-care techniques such as stretching and strengthening exercises at home. After 5 sessions, the patient was able to resume her desk job without any pain. She could walk and climb stairs effortlessly. I followed up with her after 3 months and she reported that she was still continuing her home exercise program and had no symptoms. She was off all medication and was able to live her life without pain. To assess the effectiveness of her treatment, I used several outcome measures. The patient's NRS score decreased from 8 on 10 to 0 on 10, indicating a significant reduction in pain severity. The patient's ODI score decreased from 40% to 0%, indicating a significant improvement in functional disability. The patient's GROC score was +7, indicating a significant improvement in overall function and quality of life. This case study highlights the importance of thorough assessment and proper diagnosis in physiotherapy. Lumbar radiculopathy can mimic knee pain, and it's essential to identify the underlying cause to provide effective treatment. Directional preference exercises can be a valued tool in management of lumbar radiculopathy, allowing patients to reclaim their motion and live pain-free lives.